I am tearing up.
I just about screamed right now, and I'm not even there.
Now that's inspirational, Natalie. I feel inspired today.
I could be here for another hour.
And I was talking to my class. There were only 2 of us, and the other guy was in the hospital. So here I am.
And I always go, he winds up homeless on the street. It's my fault.
Yeah, now you sound like my wife.
And you can get off.
I don't know. Call it Google. Or call it Google.
Yeah. Control. Alexa, how does he get across?
Paul, I cut you off earlier. What were you going to say?
What?
Dang it! Don't do that to me, Paul. Don't do that to me, man.
I don't know what got into my head, but I thought this thought, if I'm working year round, I might as well get paid year round.
Sweet Talk is a weekly 20-minute podcast brought to you by the Continuing Education and Workforce Training Division of Idaho State University's College of Technology. Find us on Apple Podcasts, Spotify, and SoundCloud, and subscribe today. Now, it's time to get started with Sweet Talk.
Hello, everyone. Welcome to Sweet Talk, the podcast for Idaho State University Continuing Education Workforce Training. Welcome today. And today we have my brand new or continuing co-host, Gary Salazar, Director of Continuing Education Workforce Training. Gary, how are you doing today?
I'm doing great. And thank you very much. It's good to join you again, Paul. How are you today?
I'm doing excellent. It has been so cold last few days, and I just came back from lunch and I noticed that the temperature had risen up almost 10 degrees while I was between going there and coming back, and it's sunny, and so it's turning into a wonderful day today.
Yeah, it is. It's looking really nice outside. I got back as well. If the rest of the week goes like this and the weekend's fine, I'm happy.
I'm happy too. So, Gary, we have a couple more guests today, don't we?
We do. We're being joined today by one of our instructors in our health programs, Renees Teaching, and also by our health programs coordinator, Ray Lynn Price. We're going to let her take this away and let her introduce Renee. But these two, they combine to make a really powerful portion of our occupational health offerings. So glad to have Renee and Ray Lynn here. Ray Lynn, thank you for joining us. You want to say a few words about Renee?
You bet. We are so excited to have Renee with us on this podcast, and we're even more excited to have her as our dental assisting instructor. She came on last spring, and her first class that she taught was actually with the school district 25, the high school students, and she did an excellent job with that course. And then she has since then taken on a course out at Chauvin High School and our community courses. So I just want to introduce to you Renee Teaching.
Yeah, welcome, Renee. She's awesome.
Renee.
I got to say this. I mean, she shows up early for her class. I catch her downstairs in the classroom, and she's always laying things out. And she's such a fantastic teacher. She's so caring. I mean, you picked a good instructor there. So welcome, Renee. It's glad to have you here.
Thank you so much. I'm glad to be able to do this with you, and honored, actually. So thank you.
Honored. All right, she's honored, Paul. We're done, man. She's really honored.
Yeah, we can't done. We want to close on that.
Yeah.
So, Renee, could you? I'm a novice at this entire thing. Can you explain to me, exactly, your program and what it involves and what your part teaching is? I have no clue. Renee, I've known Raylan for years, and I never asked her. About her classes.
Well, Raylyn is awesome. She's very supportive, and she's really helped me to become a better teacher by her positive attitude. But what I am teaching is the fundamentals of dental assisting. I'm helping the students to learn about dental anatomy, what we do in the dental office as an assistant. I also let them know that you don't have to take this program to be a dental assistant, but it helps a ton to understand. And a dentist would like you to be knowledgeable of tooth numbers, tooth diseases. We get to learn about different diseases and cross-contamination. It definitely makes them more aware of how germs can cross and how we are to protect ourselves. I teach them that they need compassion in order to work with their patients, but you need compassion anywhere you go. I also teach them to be non-judgmental, and we don't ever, I teach them not ever to judge somebody by their teeth or their appearance. So I teach them the basics, and sometimes I go into more detail because there's certain chapters that I really like, and so I'm able to help them with that.
That's awesome. Can your students get jobs going through as a dental assistant? Can they get work like that?
Yes, in fact, last community class, I had 4 students that were already working for a dentist, and they wanted to take the course so that they could learn how to make temporaries, that they could know more about the anatomy and fillings and charting. And they actually, by just a month before they ended the class, they told me they got a raise. Yeah, and one was a student, and within 2 months she got hired within the class. I had another one after the class was done, completed. She got a job, and I just, with a pediodontist, the other one was a general dentist, and one was an orthodontic that got a job. So
excellent.
Yeah, so yes. And
that's pretty cool. That's, you know, that is so nice. The students can get work from this. Can I clarify something with you? I'm not up to speed on, this is not a dental hygienist. This is a dental assistant, or are they the same thing?
No, they are not the same thing. A dental hygienist will go through a 2-year program that they are learning all about cleaning teeth, about giving injections, about dental health. Dental assisting is going to teach you to assist the dentist and work on your own. I mean, you've heard about, or you might have gotten a crown, a root canal. Maybe you know somebody that has dentures. Well, this is something a dental assistant will do. They'll take x-rays, they'll take impressions, they'll be taking care of sterilization. Everybody needs to learn about sterilization. So we're going to take the instruments that have been used by our patients, we're going to take them into sterilization. We need to know how to clean those instruments, and how to be able to even, like I said, charting for the doctor for treatment. We need to learn about insurance. I mean, hygienists learn all these things, but they learn how to prep a tooth. They know how to fill a filling. We just need to know what the steps are to do those things.
Okay. Thank you for clearing that up.
So,
oh, go ahead, Paul.
so I was just wondering, what profession are you in right now, Renee? I mean, are you a dental hygienist or?
No, I'm a dental assistant.
Okay.
Yeah, I went to school in 1980. I was just 19 at the time, and I went to an evening class that was an hour and a half away, and it took 9 months, and I became a dental assistant, a dental assistant with a certificate. Let's just say that.
Okay.
And then in California, they want you to become a registered dental assistant in order to make a little bit more money. So I did that right after I was dental assisting. I was doing it while I was doing an externship with a dentist. And so with being a registered dental assistant, I had to take extra courses. I had to take another course to be licensed in, which is x-rays, radiographs. And then I also had to take another exam for, excuse me, for coronal polishing, which is that polishing of the teeth that they do.
Yeah.
So yeah.
Great. So it sounds like you've had a long career. So speaking of one who used to have fear of dentists, you must have run into that a lot. And how do you address that? I mean, how do you teach, I guess, empathy, or, that understanding that people do have these hesitations of coming to the dentist office?
Well, it came natural for me. I mean, I'm that way, but in teaching my students, because I taught back in 2006 to 2008 with a private company, dental assisting, and I have just really emphasized that compassion and empathy is really important. Yes, I've had people that are close to me that say, no, I don't like going to the dentist, and going with them. But I've also had children, adults, and I just build a rapport with them. And I am sincere. And I'm not, I mean, in our learning, it says, say the right things at the right time. Well, I'm being sincere when I say, I'll hold your hand. This is what the treatment plan is. This is what we're going to do. I use different language, the language that we learn in school. It's not a shot, it's an injection. We're going to get you numb. I try to explain that. Making sure that they know that I'm there and that they'll be safe. And that's another aspect that we teach. I mean, that's one of the important responsibilities of a dental assistant, is to make sure the patient is safe. And that means emotionally and physically as well.
That's awesome. So Renee, what has been the most rewarding part of your career in dental assisting?
Oh my gosh. I would have to say that I'm going to be emotional. I would have to say that having a patient, when you've left one office to expand your knowledge with another type of dentist, that they look for you, they search for you. Because usually when you leave an office, whether it's on good terms, which I did, or I did leave in good terms, but they don't always tell the patient where you are because of HIPAA, right? So, but this patient worked very hard to find where I was, and she came and she says, I can't go to a dentist or see the dentist unless you're there. And that made me feel really good, but because I was the one, she was so fearful, and I was the one that assisted with her. Also, when patients say, I want Renee to assist me, they specifically want me to assist. So that's rewarding. As a teacher, it's rewarding to me to see when the students get it. And when they're like, I can do this. And it's just, yeah, you can do this. Whether it be taking an x-ray, or like we did the other night, we did some charting, and I call it coloring and outlining. But when they get it and they're like, oh, okay. So that's rewarding to me.
those light bulb moments, the aha moments, right? Where it
Yep.
clicks. Those are the rewards for teaching, for sure. And then when they go on to do good things, right?
Oh, yeah. When they tell me I have a job. Yeah.
Yes. That's always exciting.
Yep.
Yeah, that is so neat. And what a great description of something that, you get to feel back from what happens when a student gets it, the light bulb comes on, or they get a job, and you find out about that, or you see it. That's one of the best parts of teaching and learning as well.
Oh, definitely.
It describes the best teachers, Renee. It really does. So thank you again for that. Hey, I got a question for you. Along those lines, what is the hardest thing for you to teach? What is the most complex thing that students need to learn, where you feel like you've got to take more extra time?
I would say the part of the hardest thing to teach, you mean?
Yeah, because I thought you'd say it's spelling the words or something, because there's a lot of terms out there that are, we were goofing off before this.
Right.
They're hard to say, some of these things. It's that scientific language. Is language an issue, or are there other things?
No, I would say more it will be take an impression.
Oh, a tooth impression.
Yeah, the whole mouth impression. Yeah, for like study models, or what laymen call casts of teeth. So that's one that you really need to know. I mean, it's not easy. It might look easy, but it's not. You really need to know how to get all the landmarks on this impression, and I'm going to say the frenums. So yeah, those are attachments, by the way.
Okay, well, thank you so much. I didn't know what frenums were. So are they practicing on each other in your class, or do they have like example dentures that they work on?
Well, we do work on each other. And I always, when we first start, they're always so quiet and they don't want to talk to each other. I mean, a few do, but then by the time that we are doing our competency skills about landmarks on the face, and we're doing, I call it head, shoulders, knees, and toes, even though we don't do shoulders, but we don't do knees and toes, but we point to landmarks on the face. This is the ala, this is the philtrum, this is the tragus of the ear. This is when it's the, like the third chapter, and then we start laughing and enjoying each other. We do sit each other into the chair and treat them that they're a patient, and take impressions. How do we hold the suction, the high volume evacuator? So it's really fun, and taking impressions and pouring them up and trimming them is a blast. I have to say, I enjoy it.
They also, Gary, have typodonts. So
yes, we do
work on the typodonts as well.
A typodon is like sounds like a dinosaur. A typodon.
I was going to say dinosaur.
What's a typodon?
It is a replica of a human mouth, of the maxilla, the upper, and the mandible, the lower jaw, and it has 32 teeth in it, and it has an articulator so we can open and close it. And we learn about surfaces of the teeth, the periodontal, the gingiva. We learn about what malocclusion is, what articulating paper is for. So how to take an impression for a crown. So and make a temporary. Yeah.
Oh, wow. That's a lot. I want to share something back with you, because you touched on this. I mean, you talked about empathy and relating to patients. I'm one of those guys. I'm not really keen on going to the dentist's office. It's a must do, but I do recall, laying back in that really comfortable chair and I was probably looking like I was struggling, and the dental assistant or somebody reached out and grabbed my arm to soothe me, probably, but I jumped. You know, it was like halfway out of the chair. And I go, oh my gosh, I'm so sorry, because obviously I knocked some things off the table and created a bit of a disturbance. But the fact that somebody would take the time, you know, to do something like that, you know, I look back on it and go, oh yeah, that was really cool. You know, I'm glad that person was there. And that's a wonderful thing to be sharing with other folks. Not everybody has that fear of going to a dental office, but for those of us who do, you know, that's important for you to be helping others understand what that's about, so they're as positive as the dental assistants that I've had. Thank you for that.
You're welcome.
Yeah. Hey, I have a favorite question for you, and this is just coming at you. It's like a Jeopardy question. What is your favorite tooth?
Okay. My favorite tooth, you're talking about what my favorite tooth is to work on, or are you talking about my favorite tooth in general?
Are they different?
I was gonna say, is there a difference?
Well, I don't know.
like, dude, this is my favorite tooth to work on, but you know, when I look in that mirror, this is the one.
I have one I don't like, and I have one I do like. But I would have to say that it is tooth number 30.
Number 30?
Yeah.
I don't know what number 30 is. Paul, what's the number?
It's your lower right first molar. It's the easiest to see if you're assisting a doctor that's right-handed.
Ah.
Okay. Not sure how I'm going to see that, but okay.
I have a favorite tooth too, Gary. You didn't ask me about my favorite tooth.
You're right, Raylan. What is your favorite tooth? Give me a number.
Well, it's a love-hate relationship, because every time I go get my teeth cleaned with somebody different or go to a dentist, they're like, what is that on your tooth? And back when I got married, my dentist, I was getting a crown, and he decided to surprise me by putting art on my tooth.
Oh, what tattoo?
So it has wedding bells on a tooth, and you can't see it. It's clear in the back, but it surprises everybody that looks in my mouth. They're like, what is that on your tooth?
Hey, you're gonna have to
Wedding
show
bells.
me. Come down. I want to see.
Yep. So that's, I guess, my favorite.
I feel like I've just instantly learned so much more about Ray Lynn than I did.
I know. Good thing my marriage has lasted, right?
Amen.
Well, Ray Lynn and Renee, thank you for joining us. I don't know if you heard our timer go off, but we just met and went past the 20-minute mark. So this has been a delightful discussion. And I'm glad we got a chance to figure out, you know, which tooths are the best ones here. You've got to come back and tell me this numbering system, because that confuses the heck out of me. I just know that right now that there's at least 30 of them out there.
There's 32.
32. I still have all of mine.
Congratulations. Isn't it common for folks to lose those big back ones?
Wisdom teeth, yeah.
Wisdom teeth, yes, yes.
Yeah. My dentist loves that.
I love doing extractions, by the way.
So Raylan, Renee, if people wanted to reach out about the program, how would they do that?
Well, the best place to find out more information as far as the program goes is our cetrain.isu.edu. Look under the health programs. You can search dental assisting, or of course you can always call our office 208-282-3372, and we can get you more information. Come join our class. It's a lot of fun.
Oh, it is. It is.
It must be, Renee. It's been a joy to be with you today.
Thank you for having me.
No, thank you for coming.
She is joyful and is an excellent teacher. So
thank you.
Well, this shows through. Thank you, Renee.
Well, you know, if anyone else is interested in any of our other programs, it is the same information, cetrain.isu.edu, and you can call us at 208-282-3372. I want to thank you all for joining me today. Gary, always a good time. Always a good time, man.
This is awesome. You all be safe out there. Thank you.
Yes.
Thank you.
Thank you.
Thank you.